Good afternoon, Berkeley, and thank you for joining me once again for a virtual town hall with our city manager, D. Williams-Ridley, and our City of Berkeley Health Officer, Dr. Lisa Hernandez. Thank you for joining us today. We look forward to answering your questions and also to update you on the city's efforts to address the COVID-19 pandemic. I just want to say how proud I am to be Mayor of Berkeley at this time. While this is no doubt one of the most challenging times in the history of our city, I'm amazed about how our city has rallied and come together. And while this is Memorial Day weekend and the weather is beautiful, it is important to know that the threat of COVID-19 still exists in our city and in our region and in our world. And while you may be going outside to enjoy the beautiful weather and to also get some fresh air and exercise, it is important that you follow the guidance from our health officer to wear a facial covering when you are outside, to practice physical distancing of at least 6 feet when you are with individuals who are not in your household, and then also to shelter at home as much as possible. It is making a difference to reduce the spread of this virus and to keep our community safe. So today we'll talk about the city's efforts to expand testing, to address the recent wave of infections that have occurred in some of our nursing homes and the city's strategies to address that and keep the staff as well as the residents of our residential living facilities safe. And also to talk about the city's recent shelter-in-place order and some of the new restrictions that have been lifted around recreation and also around our planning for the future. So we look forward to taking your questions. And with that, I'd like to turn the floor over to our City of Berkeley Health Officer, Dr. Lisa Hernandez. And Dr. Hernandez, thank you for joining us today. I know you're incredibly busy, but we really appreciate you participating every week in these town halls. I know the Berkeley community really appreciates it. If you can give us an update on the number of cases as of today, as well as efforts to expand testing. And I know we've gotten a lot of questions around nursing homes and other residential living facilities and care facilities, and what is the city's efforts to address the need for testing and to reduce the spread of COVID-19 in these nursing homes. And anything else you would like to also update the Berkeley community on would be greatly appreciated. So Dr. Hernandez.
Great. Hi, good afternoon. I hope you can hear me well. I feel like my connection might be a little bit off, but I'll continue to go through my data and you let me know if you can't hear me, Mr. Mayor, please. In terms of the number of cases that we have in the county of Alameda County, we have 2,682 confirmed cases. That's not including the city of Berkeley cases, and 91 deaths. In the city of Berkeley, we have 85 cases now with 1 death. And I want to talk a little bit about our testing numbers and then go into that specific question about like why our numbers are increasing. So we now have currently have 2,300 tests that have been reported and performed on City of Berkeley residents. And that is about a 3.5% positive rate. So of those 2,300 case tests, 3.5% of them are positive. And we're getting about 56 tests performed daily and reported to us. And that's an increase of about 20%, 22% in the last week. So we are seeing an increase in the number of testing. And that's one of the reasons why we're seeing an increase in the number of cases. We're also seeing an increase in number of cases because, as expected, we're going to see more cases because people are able to move around more. So we're seeing these cases in a number of different settings. People who are members of households and they've infected other people in their household. That's the number one way we're seeing transmission happening in the city. It's one person brings it home and they are transmitting it to their family members. We, as mentioned by you, Mr. Mayor, we do have an outbreak in one of our skilled nursing facilities. And actually that just bumped up our number by one in the number of reported cases. So we are testing. Can you hear me, Mr. Mayor?
I can hear you, yes.
Okay, great. It just I guess my internet is a little unstable, so I was worried that you couldn't hear me. So we have that outbreak in the skilled nursing facility, and we've actually tested. Today is the end of the testing of that whole facility, and there are currently 2 cases that were identified in that facility, and no other positives have been reported. So that's great news. We don't stop there when it comes to testing in a facility that has a case. There will be repeated testing of not only the residents, but of the staff. And there's other work that's being done with that facility in terms of making sure those that were positive are moved from their area so they're not exposing other people. Actually, one person that was positive is no longer at the site. The other individual is being isolated and not exposing other individuals. Those that have been exposed are also being quarantined. So again, they're also removed from exposing other people until we continue to monitor and release the facility. There are no additional admissions that are being allowed at that facility as well. Before I go into more specifics about what we do at a skilled nursing facility, I want to talk a little bit about well, actually, let's talk about the skilled nursing support plan. So we, as people know, have 6 long-term care facilities within our jurisdiction. And we provide support in 2 basic categories. One is prevention, outbreak prevention, and the other is outbreak management. In terms of our prevention efforts, we meet with the facilities weekly to talk to them about their plans, how they're protecting their residents and their staff, how their personal protective equipment supply is, how their protocols are in terms of isolation and quarantine and testing, and also providing them consultation. As people may know, there's actually some guidance from the state, from licensing and certification that has been actually updated as of last night in terms of the testing requirements to support that the facilities have to provide to their residents and staff. And we're working with the facilities to make sure that they're adhering to that. One of the things is testing. As you know, we started testing at the facilities earlier this month, and we're halfway through. We're tested about 40% of the staff and residents of the facilities, and we will continue to do what's called surveillance testing at the facilities, where we're testing everyone in the facility, whether they're symptomatic or not, and that's both residents and staff. And that will be completed by mid of June. Basically, we're testing 1 facility a week. And that's a heavy lift. After we do that testing, we're working with the facilities, making sure they're trained on doing testing themselves, and we're working with them to have a cycle of what we're calling early warning surveillance, where we're doing testing on helping them test both their residents and their staff in cycles, so that we're testing 100% of their facility over a month's course of time. So that's going to be starting after we do our round of surveillance testing, where they will continually be doing testing at their sites. When it comes to outbreak management, I talked a little bit about that earlier in terms of that specific facility, but we're working with the facilities to make sure they have their plans together. They have their staffing, because we know, as we've seen in other jurisdictions, when there is a positive case, staff get worried and they may not come to work. So we want to make sure they have their staffing ready and support it, and they have contingency plans, not only to have staff available if staff aren't presenting to work, but also making sure that their staff is safe. So we're working on them with that. We've gotten support from the California Department of Public Health on those issues. So that's our SNF support plan that we have in place. And if I can, I'll go over to our City of Berkeley progress report. So as many know, we have 5 indicators that the 6 other health officers and myself are using as we move through our shelter in place restrictions and relaxations of those restrictions. And we have a progress report that we've been monitoring our indicators on. And I wanted to go through those 5 indicators pretty quickly, but just to give you an update on those indicators. So first indicator is specifically focused on cases and hospitalizations, that those numbers are flat or decreasing. We are in a not met status on those indicators. One, because we're seeing, as we've already reported, an increase in our cases, and that we're not surprised about because of the increase in testing that we're having in our community. The second is the number of hospitalization of patients with COVID-19. That one we're watching because we've seen a slight trend upwards in the number of cases of patients who are hospitalized, and that's throughout the county. When we look at the second indicator, which is sufficient hospital capacity so that they can meet the needs of the patients in our community for both COVID and non-COVID hospitalizations, that is actually met. So that's in the green range when we look at that status. When we look at indicator 3, which is sufficient testing capacity, that's in what I would call the yellow phase. We're seeing progress in that as reported. We've increased our capacity within the city to at least 20% increase since last report. And we actually believe that our tests are a little higher than what we're seeing reported to us because of the delay in testing from the labs. Indicator 4 is sufficient disease containment capacity within the city. That we're at green, and we have the 4 90s is what I call them in terms of the indicators that we're using for that. And I'll just go through them very quickly, but just so that people know where we are with that status. The first 90 is 90% of all cases are reached and contacts are identified. We're at 97%. So that means 90% of all cases have been reached and their contacts have been identified when we interview them. The second 90 is 90% of cases that we reach are safely isolated. We're at 95%. So that is why we're at green for that in part of the indicator. The third 90 is 90% of all cases that we reach are isolated. Our contacts that we reach are reached, that are identified are reached. And that is at 97%. And then the last 90 is 90% of all contacts are able to safely quarantine. And we're exactly at 90% for that. So that is why we reached all clear that that indicator has been met. Our last indicator is sufficient personal protective equipment for our hospitals and our healthcare providers in the community. We are at a orange phase where we're partially met in some of those areas, but not completely. So we're watching that. In terms of our acute care hospital, having certified that they have access to 30-day supply of personal protective equipment, they have certified that they have that supply. So that is great news in terms of having the equipment for our acute hospital in our jurisdiction. In terms of having enough personal protective equipment for all our facilities in our jurisdiction, that has not met because we are seeing that our facilities are not having all the equipment that they can procure on their own. We know the supply is increasing, but it's not there where they do not have to ask for resource requests from the city to help them meet their supply. So we're watching all those 5 indicators. We're making progress in some, and some we're watching, but I wanted to make sure you knew what the progress was. In terms of our shelter in place, as reported, we had our recent relaxation of the restrictions starting this Monday that just passed, and that has allowed all curbside retail as well as delivery for the retails, and any manufacturing and any of the logistics in our jurisdiction. So that has allowed a bit more movement and availability of service and retail in our community, which we're happy that we were able to release. The second part was, as mentioned by the mayor, our ability to allow tennis and pickleball. And I am happy that we were able to do that. That is in singles, and I have seen people utilizing the courts. So I was hoping that as we move forward, we will continue to watch these indicators and hopefully able to relax some of the restrictions. My crystal ball is that most of the things that we'll look at relaxing will be more of the outdoor activities, hopefully more relaxation on some of the recreation, hopefully some more relaxation on childcare and camps. We're working with the schools because we know we're wondering and worried about school year. I myself as a mom am worried about that as well. So we are hoping to get those moving and a little more solidified in the coming weeks. So I'll end my report there and turn it back over to you, Mr. Mayor.
Okay, thank you very much, Dr. Hernandez. One thing I know we'll touch upon in the questions is how we use the indicators and tracking our progress with meeting the indicators to make decisions on easing some of the restrictions in the shelter-in-place order. We're using that as a benchmark in some of the decision making. And so I know that we had some questions around the shelter-in-place order, and maybe we can talk a little bit about that. And it's also not a conversation that's just happening in the city of Berkeley. It's a conversation that's happening regionally with all the other health officers to make sure that we have a unified approach, knowing that that people move across borders and that we have to have a coherent regional strategy to how we address this. So thank you very much. So I'm now going to turn the floor over to our city manager, Dee Williams-Ridley, and thank you for joining us, Madam City Manager. And if you can update us on city operations and anything else you'd like to share with the Berkeley community this afternoon.
Thank you, Mr. Mayor. And yes, we are still churning away with basic operations for our community. I do want to highlight a few things. As you know, we're still working very closely with our unhoused community. So we're out there every week, every day, and we are working with folks. We have noticed an uptick in illegal dumping across the city. I want to urge our community to call our waste resources, waste management, call 311. Please continue to report sightings of illegal dumping so that we can get out there and keep our city streets clean. We're asking people to allow our sidewalks to be safe. We know we have to share the sidewalks now with our unhoused, but we need the community and our advocates to support us in getting out there and talking to folks about gently moving back so that everyone can have access to our streets and sidewalks. We're also very excited that our transportation department has lifted up a healthy, safe streets program, and we will be kicking and launching that off next week. You should hear more about this on Tuesday. We'll be releasing information. We want to first educate the community and our volunteers. We're very excited to have the support of Walk by Berkeley to help us to unify our volunteers to help this effort stay safe in the communities. One of the things that we're really excited about is the fact that we initially thought we'd have to leave, have signs up where people and community members would have to take them down every night. We will have reflector signs so so that those streets can remain just accessible for through traffic during night and day. So those signs will not be removed. They'll be there all night, all day, which I think provides a great amount of freedom for our community. And then our volunteers will be able to maintain the safe streets signature signs midway during those intersections. So we're really excited to provide this service to Berkeley. It is a temporary during our shelter in place. We will reassess how we move that program forward and what that will look like in the future. So I'm very grateful to the transportation team, particularly Phil Harrington, our director, and Phil Jovendal. I'm very, very excited to announce that we will have street closures in Berkeley so that our families and children can get outside and be on the streets and on the areas that are usually thoroughfares for traffic. So asking our citizens to slow down, make sure you observe the roadways and make sure you observe the signage to keep our young people safe. And then I also wanted to just talk a little bit about our unhoused community. We are going to be coming to council with a urgency item so that we can secure a contract to actually provide direct services to unhoused community members in our trailers. As you know, we secured trailers through Oakland in a joint agreement program with them, and the city also purchased over $150,000 worth of trailers, which totaled about 8 trailers to house our unhoused community. So we will be housing 18 families in those trailers very, very soon, but we certainly will need to make sure we secure a contractor to go in and actually work with those families. So that's the last step. And then we will be kicking that program off and occupying those trailers. And I know folks are very interested to know where we are with that. So we've been stocking the trailers up, getting them ready for people to actually utilize them, bedding and different things that people will need to actually live in the trailers. So we've been doing a lot of work behind the scenes, and now we're starting to get excited about getting folks off our streets and into some of those trailers. Lastly, I do want to shed light. I know I know as we're getting ready for a wonderful, wonderful weekend of warm, sunny weather forecast, I had to strap myself in the chair this morning to have this conversation. But this is a long weekend, and many of us are really looking forward to time outside. So even under shelter in place, visiting parks, trails, and open space, it is permitted, and we encourage it. It's a way to get to relieve a lot of stress, get some fresh air, vitamin D, and really stay active. However, I think it's still important to take COVID-19 precautions. As many of you are aware, and if you visit our website, the CDC has advice for protecting yourselves and others during outdoor recreation. And I do want to point out just a few of those recommendations from the CDC. Here are some do's and don'ts. And if you go to their website, you'll see them. Do visit our parks that are close to your home. Don't go too far, try and stay in your immediate vicinity. Prepare yourself for your visit. Take your own water bottles, make sure you have a face covering, and also stay at least 6 feet away from others and take other steps to prevent COVID-19. And then here's some don'ts, and I'm not going to focus a lot of time on things not to do, but I think it's important for me to state them. Don't visit parks if you're sick or you were recently exposed to COVID-19. Avoid visiting crowded parks and avoid using playground equipment that hasn't been secured or locked down. And then avoid participating in organized activities or sports. So those are there are a lot of do's and don'ts, but I think those are some of the significant ones that I think are important and simple for folks to hear about. And then lastly, clearly, there's a lot of advice out there for our California Department of Parks and Recreation. They've created a one-stop online resource. I think that's an important resource for folks to see as well, especially if you live close by a California park that's not a local park within Berkeley. You can also find information on COVID-19 park closures, and that information can be found at www.parks.ca.gov. Please recreate responsibly. And also you can tune into free broadcast style home learning programs for K through 12 students from various parks located across California. And you can go to that site at www.ports-ca.us/. And all of this is available on our website, City of Berkeley's website. So you don't have to write it down. Just go to the City of Berkeley's website for more information. Thank you, Mr. Mayor, for hosting today. I'll turn it back
Thank
over
you.
to you.
So our City of Berkeley website also has information about what parks and open spaces are open for public use. And as noted, we have begun to ease some of the restrictions on the use of athletic facilities, although we have not lifted all those restrictions. So, so please only go to those parks and use those facilities that you are able to. And if you do, please remember to not go to parks that are so crowded and to not cluster with large groups of people, because that could put you or other people susceptible to transmitting COVID-19. So it's important that we safely enjoy the beautiful weather and that we enjoy this weekend. And thank you, Madam City Manager, for highlighting that guidance. I think it's important that people hear that so that we can safely get outside and recreate and enjoy this weekend. So with that, I'd like to go to the questions. We received a number of questions from Berkeley residents, and I first want to turn to the city manager for a number of operational related questions. So the first question that's been asked is, has a new hotel been identified to provide accommodations to unhoused individuals? And you touched upon the trailers, but I understand that we are going to be developing our own Project Room Key program in the city of Berkeley.
We are taking steps to look to re-engage in how we find a hotel here locally. We are also going to continue utilizing regional hotels to house some of our unhoused. Right now, I don't have an update for you on where we are, but we are certainly still looking to find another resource here in Berkeley. We do believe that regionally, we want to fill up those hotels that are available currently. And Alameda County, who's the host of the Room Key program across for our cities, they are continuing also to look for other opportunities. Now, that may not be here in Berkeley, but we are also looking just here locally, as well as trying to work with them in finding a location where we can house as many Berkeley unhoused as possible. So more to come on that. I expect that we'll have some news soon on what we're looking at here in Berkeley. But for now, we are truly going to focus on getting at least 18 which could be, I'm going to look at my numbers here, but I do believe the numbers for getting folks off the street, we will be housing at the trailers at Harrison Street can hold 2 people. So we'll get at least 20 people instantly off of our streets. That may not sound like a huge number to people, but it really is a huge number. And then 8 people at the university trailers, and then another 4 people at the home that we secured with 4-bedroom home. So we're anticipating seeing a good group of folks coming off of our streets and going into local housing options. But again, we will continue looking for another hotel here in Berkeley.
Thank you very much. So I'm going to kind of merge a few questions relating to the status of certain city services and facilities. So the first question is, when will Berkeley's libraries reopen? And second, when will other recreation facilities such as pools, baseball fields, and soccer fields reopen? And at the present time, none of those are open for public use.
So I'll share this space with Dr. Hernandez, because I believe a lot of the movement will require some of the indicators that she spoke about, as well as the regional conversations that are happening in how we do this collectively, but also safely. We're not there yet. I know that it's getting hot, and we would love to have the opportunity to have our families utilize our pools. But we have, number one, we've repurposed the use of them until such time that the pools are open. So especially for showers for our unhoused, we're allowing the facilities for those types of activities. As you know, we have 3 shower resources in Berkeley for that, and one of them is at the West Berkeley pool. And we've also used, I believe, King Pool to actually allow for decontamination for our firefighters and some of our essential service workers. I don't know if we're still utilizing it in that capacity at this time, but we had initially started utilizing it for that purpose. But at this time, pools are still restricted, as you stated, Mr. Mayor, and we will look to easing that as soon as we can, but it has to be safe and it has to be something that we do regionally. Dr. Hernandez, I don't know if you want to add a little bit more to that, or.
I think you covered it very well, Madam City Manager. I would add to that, though, that I'm hopeful that the next phase that we will look at more of the outdoor activities, because we know that the outdoors are a more safer environment than the indoors. I will say that as you see some of the relaxations or the restrictions, it's not going to be the same as it used to be in terms of everyone being able to recreate even in the way that they used to. As you noted, in terms of our tennis, it's singles only. It's not that we're allowing people to play tennis and doubles even, so that mixed group. What we're looking at is looking at relaxing things in that incremental way, potentially outdoor activities before indoor activities, and also looking at pods or stable groups. That's how we've relaxed our camps and activities for children, is in a stable group of 12. So that's sort of what we're looking at for as we move forward. So that would also apply potentially to what we do for the fields, what we do for the pools. I know my children are swimmers and water polo players, so the pool thing is a discussion we have at home too. So we hope to be able to release some of those restrictions soon, but again, it's going to be based on the impact of the relaxations that we've seen thus far.
So, Dr. Hernandez, on that point, could you maybe touch upon what do we look to in terms of the data to inform decisions on whether to ease restrictions or put in place certain restrictions? You talked about looking at whether lifting certain restrictions has resulted in a spike in cases. That's one indicator that we look at. We have also the 5 regional indicators that we're looking at as well. Anything you can share with the Berkeley community about sort of as one of the 7 regional health officers, what are the health officers looking at to inform that discussion?
So it is these indicators. We also, one thing that I haven't mentioned today is the cadence. So what is it, like how frequently do we feel comfortable in relaxing these restrictions? And really, we cannot relax things sooner than 2 weeks, because we know that the incubation period for COVID-19 is 14 days. That's the outside limit of the impact of or exposure for someone who has been exposed to COVID-19. So that's why we do things in no sooner than 14 days, because of that in the incubation period. So so that's one thing I want to let you know. We are looking at these numbers daily. The dashboards that you see both on our city webpage, as well as the ones in our region, are the data that we look at. We also have internal conversations with the 7 health officers, as well as our staff, epidemiologists, our disease containment staff, to see how these impacts are occurring or impacting our community. We also are having conversations within our jurisdictions with our city, in our case, our city department. So these are not things that we are doing solely on our own as public health. So that's the other thing I just wanted to mention, Mr. Mayor, in terms of how we're making these decisions, is that we're looking at these indicators, the cadence, as well as the collaboration that we have with city leadership.
Thank you so very much. Madam City Manager, there's a question about sanitation of city buildings, knowing that some essential staff are working in city buildings during this pandemic. Our city buildings that essential staff are utilizing being additionally sanitized. And there was a specific question about whether additional sanitizing is how the city is paying for that, what funding stream. I come in City Hall. I'm here in City Hall right now, actually, and there are not a lot of people working in City Hall. A lot of people are working from home. And even as we start bringing staff back, there will be a number of staff that still will be working from home.
Correct. We do plan to continue having a telework environment for the city. We're looking at long-term telework. We've developed a new policy around telework, so folks will not be able to come back in the same way that they used to work. We will be maintaining 6-foot distances in terms of workspace and cubicles. We will be cleaning and will continue to clean the city facilities regularly, signage for elevators, education, training. We've also put up plexiglass, I guess you could call it it's not plastic. Ooh, not plastic. It's plexiglass. So we put up screens to prevent, the transmittal of these micro transmits of possible COVID and possibly not, but we wanted to make a safer environment for our employees to return. So there are very few employees that are working inside buildings right now. We do have a lot of outdoor employees. We still have street staff, transportation staff, park staff that are working in our city. And June 1st, we are starting to move folks back in to the city slowly. Again, respecting social distancing, respecting the cleaning up and the providing the personal clean soap and water and all of the supplies that you need, sanitizers that we'll need on hand, and also having available face coverings at every entry so that as people come, if they forget their facial coverings, we'll have additional face coverings there for them. So the goal is to bring people back safely, to be very thoughtful about their workspace and their environment. We'll be flexing people as they come in and out. And in terms of how the costs are, these costs are shared across all departments, all funds, general funds, special funds. So they're shared costs. So there isn't one bucket of money that we pay out of just to cover costs for maintenance, security, and cleanliness. So, but it's all part of multiple funds within the city. I don't have a exact cost of what we pay for sanitation of our city or maintenance of our city buildings on hand, but we do utilize all funds across the city.
Thank you very much. So I have a question that may be best posed to both the city manager and Dr. Hernandez. It's Memorial Day weekend. The weather is beautiful. A lot of people want to have outdoor backyard cocktail parties. Or outdoor play dates. So are play dates or socially distant hiking or backyard parties allowed? And what precautions should people take? I think it's important that people know what is allowed and what isn't allowed. And I know people are really struggling with having to shelter in place for such a long time. Right. And so people are really ready to kind of go back to socialization. And one of the things that we do need to look at is how we also provide guidance on socialization while also looking at how we are making modifications to the shelter in place order. So maybe you would probably be the best person, Dr. Hernandez or Madam City Manager, to answer so we can provide just some guidance to the community about this.
So Mr. Mayor, thank you. And thank you for the question. I certainly think that Dr. Hernandez should be the bearer of bad news. I'm going to let her take this one as well.
Well, and that is fine. I figured it would be me. That's fine. I got to share the tennis and pickleball last week, so I will share the bad news because I got to share the good news last week. We are not ready yet to allow mixing of groups in social settings or even hiking. I mean, socially distancing in hiking is already happening. You might pass people or hike with people or when you're going out with your family, you might see them. So that is something that I would say is already happening in terms of people interacting with others outside of their family, and that I would say is something that you have to do in a socially distanced way with your face covering. So that is something that I say is already happening in some way. In terms of the backyard parties and play dates, that is a no-no, unfortunately. We have seen in other places, whether it's in the United States, in Maryland, and in the South, where there have been relaxations that we've seen spikes in cases. We know in South Korea, they allowed, and we're not talking about night clubbing here, but we've seen like one individual who was out in certain clubs exposing hundreds of people and hundreds of people getting infected. So we cannot allow that here in our jurisdiction because we see that that impact has occurred in other places. So enjoy the outdoors. I'm looking out my window right now. Enjoy the outdoors with your family. You can shout over the fence to your neighbor and interact that way. You can Zoom. I hear there's a lot of Zoom parties that are occurring, but we cannot have mixing of groups, whether it's in play dates or in barbecues for Memorial Day. Honor the holiday as it's supposed to be honored in terms of those who have given service to our community. Put your flag out to honor those who have served our community and protected us in their public service. That's what I would say. Unfortunately, do it within your home and household.
Zoom happy hours are the new thing. So I encourage you to use Zoom and connect with your friends. And I connect with my parents through FaceTime. I know it's really hard to not see your loved ones, to not see your friends, but it is really important that you do so from a socially distanced way. So thank you, Dr. Hernandez. Just a few more questions for the city manager. So there was a question about summer programs for children. And I know that the Parks Department recently provided some information around our summer camps and summer programs, and wondering if you might be able to update us on that.
Yes, so we are opening our summer camps again. They will likely open in the next week or so. It will be very limited. We normally see over 800 plus children involved in summer camp programs in Berkeley. The numbers will be reduced to probably about 250. What we're seeing is a number of parents and families that truly want their children to be in camp, but then there's a huge amount that are concerned and worried about having them come. So we're going to measure our first deployment to around 240, 250. And then we will watch to see what the demand looks like. We will start to gradually open more if there is greater demand. So but we're poised to do that. And so at this time, on our website, you'll be able to go in and sign up and apply to have your children participate in youth camps here in Berkeley. And I would welcome folks to utilize our camps, and they will be safe. We will make sure that we maintain good, clean equipment, and we'll make sure that that our staff are practicing good social distancing skills and making sure they have face coverings. We do want to encourage parents, though, to make sure that their children stay with the group that they're with. We want these youth to stay connected. So if 12 are in the camp program, they should stay in that camp program. So, and not move from camp to camp, not trade out and bring in other folks to replace. So we're going to try to see that how this works, and hopefully we can do more in terms of greater numbers. But right now we're going to wait to see the demand.
Thank you very much.
You're welcome.
So just a comment I was asked to share. This resident wanted to share the situation walking our sidewalks is getting worse regarding social distancing, that they often have to move out into the street to avoid others. And I think that's part of the reason why we're going to be launching this Safe Streets program next week with a certain number of streets, and maybe looking at how we can increase the number of streets to make sure that people have more access to getting outside and can appropriately physically distance. Certainly when I'm walking on the street and there's a lot of people on the sidewalk, I do walk in the middle of the street to go around them. And you are encouraged to do that if you could do so safely. And then lastly, oh, I'm sorry, Madam City Manager.
Yeah, I just wanted to add that, you know, one of the things that's going to help us is if we all try and do our best to wear facial coverings, to make each other feel comfortable, but also to help us progress to reopen sooner. You know, we've got to do things that help ourselves, and behavior is one of the things that's going to move our needle. So please join us, put your facial covering on, observe the rules, make sure we're trying to keep each other and our neighbors and our seniors safe. And I know it's hard, so I encourage folks to find ways to make it fun. There is some things that we can do to make it fun. So find ways to do that with your families, and also to practice good, safe social distancing.
Absolutely. You know, I really think that we have a civic responsibility in our community to follow these directives. Many people in our community have taken very seriously the requirement to shelter in place and to also wear a face covering. Some haven't. And I know it's hard, but this is really important. And we all as a community have to come together, and we have to do this together. This is so essential for the health and safety and the future of our community. So please, Berkeley, please continue to follow the guidance. And then lastly, there was a question around my proposal that's been introduced with Vice Mayor Hahn around exploring using public spaces for outdoor dining that is going to the City Council on June 2nd. And if the council does move that forward, we will then work to explore that particular proposal. So it's not yet been adopted. It is ready to go to council. And if you have an opinion, please weigh in, and please write to the City Council at council@cityofberkeley.info. So I'm now going to go to our public health officer. I think I might have already asked a few questions or touched upon a few areas that people wanted to address today. But there were a couple of questions around the number of cases and whether there's a pattern to newfound cases. Are they appearing in particular groups? And then there was, I believe, a spike in cases on Thursday that was reported on the dashboard. And there was a question around how can we explain that spike in cases, and what measures are being taken to do the contact tracing. So if you could talk a little bit about, is there a pattern to the newfound cases, and maybe if there's any information you might be able to share around the spike in cases that we saw on Thursday, and if there's any information we may have as to why that may have been the case, we would greatly appreciate it.
Sure. So the spike was due to there wasn't a specific exposure that caused those cases to be reported to us on Thursday. We do know that that was probably something that occurred in exposures that happened about 10 to 14 days before that time. So we do know that, but the cases kind of ranged in terms of uh, who they were. Some of them were within a household. So that's why we know that that's why they all were reported around the same time, because they were individuals that were exposed to one individual. But all the other cases in the last week have been pretty much sporadic. The testing that we've increased over the last week or so has been one, increasing the amount of availability of testing within our test site. So we're seeing more people coming to that test site. And also in terms of the work that we're doing as a city, we're doing some targeted testing as I think reported last week in terms of certain high risk populations. So the homeless outreach team, as well as the lifelong medical street medicine team, are going out as they normally do, but now are offering testing to either symptomatic or asymptomatic individuals in encampments. So we're seeing more testing. So our numbers are increasing in terms of tests, because we're able to provide testing in those settings. We're, as mentioned, also, we're doing more testing within our skilled nursing facilities as well. So those three buckets, increasing the testing at our test site and allowing more people to come to the test site. And now we're having anyone who works or live in shelters and transitional housing come to the test site to get tested. Of course, that's through the nurse triage line, which is, you can call that at 510-981-5380. So that bucket is that nurse triage line in our test site. The second bucket, as I mentioned, is the targeted testing out in encampments. And then our third bucket is as doing more targeted testing in skilled nursing facilities. So those are why we're seeing more testing. Also our providers are able to test more. There's also testing that's being available regionally. We don't have a test site that's been furnished by the state, but Alameda, the rest of Alameda County has some of those facilities, and Contra Costa, and those are open to City of Berkeley residents as well. So as a whole, there's more testing available in our community.
Thank you very much. I'm going to go to a few questions on testing. As we know, there was an article on Berkeley side recently that talked about Berkeley's percentage of testing compared to some other jurisdictions. And I think there were several questions around why are we doing so little testing compared to other jurisdictions of Alameda County, other counties. And I know that part of it is we don't have a state sponsored testing site in Berkeley. So if you can touch on that. What would it take to reach the benchmark that we need to meet, which I think was around 245 tests a day, to be able to safely reopen. And then there was a question around when will we have the capacity to test asymptomatic people, and are we going to do antibody testing? Because right now we're doing the swab testing.
Yes.
So anything you can add about just sort of how we can expand testing, and what do we need to do to be able to increase that capacity? And I just want to say for the record that I'm going to do what I can as Mayor of Berkeley to advocate for the state to enable us to have our own testing site in Berkeley, which will enable us to be able to expand capacity.
Yes, thank you, Mr. Mayor. I appreciate your advocacy and support. I've been advocating squeaky wheel, so I'm hoping we're going to get some test sites. So with your support, I think we will be able to move farther on that advocacy. And first, I want to just mention the comment about our indicator and reaching the 245 tests per day goal. All the indicators are ones that we're looking at for making progress. Of course, as we know, we relaxed some of the shelter-in-place restrictions even before we had met those indicators 100%. We're not expecting to reach those indicators at 100% before we relax, but we're watching how those indicators change over time to see how the impacts have what impacts those relaxations have had on those 5 indicators. So it's not an all or nothing um, type approach when we're looking at these indicators. It's not like we have to meet a certain threshold, but we do have to make progress. So we have made progress with our testing. I'm hoping that we will be able to open our test site to anyone who wants to be tested, whether they're symptomatic or asymptomatic. Some of that has to do with some of the logistics in terms of making sure that we have the ability to schedule and to receive the individuals at our test site in a way that is going to be easy for individuals to sign up and get scheduled. The others that we need to make sure we don't impact the community with our traffic. So we're getting those things ramped up, and we're hoping to have that test site available for anyone who wants to get tested. And I will just say soon. I can't give you a date, but I'm hoping to have that service available to people as soon as possible. In terms of other capabilities, we know that the other providers in our community have had issues with getting test kits, the swabbing. So that's something that I'm hoping the availability will get will be a bit more easier to get soon. We have requested some resources from the state. So if providers need test kits, they can make resource requests to the Emergency Operations Center in the city, and we can help with that. In terms of the antibody test, that right now is not being used for diagnosis. It's only something that's available, and we're hoping that it can be used for diagnosis soon, but the data is still not there. Studies are still being performed before we can use that test, because that would definitely help us with increasing capacity for testing. There are also other tests that are available, so that it's not a oral swab and a nasal swab. It's a self-administered test. Those are slowly but surely becoming available through the region and our city, but we're not there yet to be offering that also at our site. And I don't know if I missed any of the questions that you had.
I think we addressed at the beginning that Alameda County and other counties have a state-run, a state-supported testing site, and Berkeley doesn't have that, even though we have our own public health department. And so that having that support will be helpful for us to be able to expand the amount of testing that we're doing in our community. So I just wanted to let the Berkeley community know
Yes.
that that's one resource we do not have, and that we are going to be working to try to secure to increase our access to testing. So a couple of other issues. There was a question around housekeepers and whether there's consideration of making housekeepers essential workers at some point. That currently is not. I don't believe that currently is. Is that currently allowed in the existing shelter-in-place order?
In special certain circumstances, they are allowed, especially for those individuals who require help in their home. Because they can't perform their daily activities on their own. If they need someone to help with house cleaning or with cooking, those individuals are allowed to come in if the individual in that household can't perform it themselves. So that is something that has been allowed. They would be considered an essential worker. In terms of the rest of us that rely on house cleaners to help us around the house, but we're able to perform the services on our own, that is something that we're not allowing yet. I know there was another part of that question about offering testing for housekeepers before they come into the household. the restriction, the limitation of any test that is being offered now for diagnosis is that when you take the test, and if it's negative for that day. It does not mean that you don't have the infection yet. It may be that it was too early in your disease process to show the amount of virus in your body. It also could mean that you're incubating and that you are also have been exposed, and you may be showing the disease in a couple of days. So it's not a test that will allow you to say that, hey, that person is safe to be in my home to perform the services that I would like them to do.
Thank you. There were some comments around socialization. We touched upon this just around certain outdoor activities that are not allowed at this time. But I think a key issue that we are going to have to address, in addition to business activity, is socialization and the guidance on socialization. So I know a lot of people are looking for guidance on that, and I know that that's something that our regional health officers are actively discussing and will be providing guidance on how to do so safely. It's really, once again, going to depend on the data around the number of positive cases and testing and how we meet those 5 indicators. But I just want everyone to know that that is another key piece, how to be able to do socialization, visiting friends, kids playing together, do so safely. But at the present time, outdoor cocktail parties and groups of friends playing together is not allowed under the order. You can go outside and hike or recreate with people that are not in your household, but you have to maintain at least a 6-foot distance between you and those individuals who aren't in your household. I'm going to address a few questions that came in that really relate to policy-related issues. We know that some of our grocery stores are no longer allowing reusable bags, which is a real transition from our bag ban policy that we implemented a number of years ago. One question was, are there plans for the reuse of plastic or paper bags? You are at this time unable to reuse a bag for other grocery shopping, but there are many other uses that you can use a plastic or paper bag for. So, I would encourage you to collect them. There's a lot of purposes, but at the present time, you are not allowed to bring your own bag for health and safety reasons. Questions around the city budget. We know that we're facing an $28.5 million deficit, and it is a very challenging situation for our city to address, to maintain essential services and promote health and safety while closing that gap. And I know our city manager and senior executive team are working very, very hard to develop a plan for how to close that budget deficit, working with the City Council Budget and Finance Committee. The Budget Committee will be meeting this upcoming Tuesday at 10 a.m. You can participate in the meeting through Zoom by going to the City Council website. We welcome your participation as well as your comments. And we're looking at the city manager's proposed deferrals of capital and non-personnel expenditures. We are looking at, the city manager has implemented a hiring freeze. We're looking at other ways that we can try to contain costs to reduce our budget deficits and to make sure we have a balanced budget. We are required to have a balanced budget by July 1. So over the next few weeks, we'll be working very, very closely with our staff, and there'll be a number of public meetings and public hearings where the community can participate. We welcome your input, but know that maintaining essential services and preserving and promoting health and safety, those are our priorities. That's the guiding principles that will guide the work of the city in balancing our budget. There was a request that the City Council pass a resolution to require comprehensive testing of all nursing home staff and residents, as was touched upon earlier in our town hall. Our staff have developed a plan, and they are working to execute that plan to test at all of our nursing homes. So I'm confident and support the city's plan, and will continue to support the work of our city manager and public health officer to address the needs of the staff and the residents in our nursing homes, who we know, looking at Pennsylvania, New York, and other states, are at greatest risk of contracting COVID-19. So we take very seriously the need to protect our most vulnerable, and I do support the city's plan. We touched upon the number of cases, 245 tests a day, which is one of several indicators that the regional health officers have developed. And measuring the progress and meeting those indicators will be key in making decisions about how we will safely reopen our economy. There was a suggestion around whether the city is considering salary reductions as a way to balance the budget. That is not currently part of any budget balancing proposal. But I think we're going to try as much as we can to find ways to defer capital projects that aren't essential and other expenditures before we start asking for concessions from existing employees. But we do know that other jurisdictions are looking at concessions as a way to try to reduce expenditures and to balance their budgets. We have a budget policy to not do layoffs unless it's necessary. And I do believe that is an essential principle that we must maintain during this very difficult period as we're working to address a significant deficit. But what's really going to be essential is the support of the state and federal government to help cities like Berkeley be able to balance our budgets and address the big gap in revenues that we're going to be seeing with 10,000 students not in town and restaurants closed and other businesses closed. And so unfortunately, it does appear at this time, and I'm just speaking on my soapbox, it does appear at this time that the Senate is not going to move forward the HEROES Act. And so this bill, which is so essential to make sure that cities like Berkeley are able to have the resources to do testing and contact tracing and serve the needs of unhoused and vulnerable populations, to make sure that we maintain a safety net as our economy is going through an unprecedented time, is so critical. And so I'm certainly going to do what I can. I encourage you to do what you can to please lobby the Senate and the president to pass the HEROES Act. It is so important for Berkeley to be able to get through this financial crisis. There was a question around commercial brokers and what can be done to encourage expediting of zoning applications and other permits. I'm happy to share this question with the city manager. I do know that our planning department has streamlined as much as possible permitting, including making applications for permitting being done online. And so we are looking at how we can move a lot of those functions remotely, and how we can find efficiencies in how we do permitting, knowing that many of our workers are not working in the permit service center, they're working from home. But Madam City Manager, I don't know if there's anything else you want to add.
Yes, and we've also reconvened a number, and will be reconvening a number of our commissions that help lead that work for our staff. But all of our services are available online. Our folks are back in. We have inspectors out there. We're doing things remotely. We're doing Zoom inspections. We are fully engaged, and we know that all construction now is back online. So we're working very, very hard to meet the needs of our community.
Thank you. Question about rent payments. What is the criteria for paying commercial rent? Why can't the city cancel all rent payments for businesses that cannot operate? We are constrained by state law in terms of what we can do. In the 1980s, the state prohibited commercial rent control, but the governor in March did adopt an executive order that does enable local governments to pass moratoriums on commercial evictions. And so on March 17th, my legislation was adopted to establish a moratorium on commercial and residential evictions during our local state of emergency. And so if you are a small business, you are not able to pay your rent due to being impacted by the COVID-19 pandemic, namely an order that says you have to suspend operations or a significant reduction in income, if you can demonstrate that you have been impacted by the COVID-19 pandemic or any of the government directives in response to that, you are protected from any eviction for non-payment of rent. I think it is going to be important that after the shelter-in-place order is lifted or significantly modified, and business activity is sort of returning, people going back to work, that we are going to have to maintain some of these essential protections, because some of our businesses are going to take a while for them to get back up on their feet. So know that Berkeley, it's actually Municipal Code Chapter 13.110, the COVID-19 Emergency Response Ordinance, that does provide protection against commercial evictions during COVID-19. There were a few questions about the university. One was, is there any way for the city to stop UC Berkeley from taking so many properties off our tax rolls? Unfortunately not, because the university is exempt under the state constitution from local taxation and land use regulation. But please know that while the university is discussing its long-range development plan, which is going to outline its plans for expansion over the next 15 years, that the city of Berkeley, even though our staff are incredibly busy dealing with this pandemic, are going to be following this process very closely and weighing in about how the university should grow in a way that is sustainable, and also protects the interests of the city as well. And we are also still in litigation with the University of California over their significant expansion. I do feel it's essential that we advocate for the university to pay their fair share. And then lastly, there was a question on the status of the university reopening this fall, and noting that many of our businesses really depend on the income from our students. The campus has not made a final decision on its plans for this fall, but President Napolitano announced this week that she envisions that a hybrid model will likely be what most University of California campuses will be operating under, where some classes are online and there is some in-person instruction. Having been a student at UC Berkeley, I know there are 700 student classes. Those are probably not going to happen. But there is a likelihood that even if some in-person instruction is going to happen, that students may choose not to come back to Berkeley. So no final decision's been announced. Please stay tuned. I know that our city staff have been in conversation with the university. I've certainly been in touch with Chancellor Christ about this. There were a number of questions that were submitted by Facebook, and we do normally ask people to submit your questions through the online form that's accessible through my website, jesseadeguin.com. We will add those questions that were submitted on Facebook to our list for next week. So while we may have not gotten them today, we'll get to them next week. So in closing, I want to thank the Berkeley residents that joined us today. It's a beautiful day. I really appreciate you taking the time to stay indoors and to hear important updates on our response to COVID-19. I believe tomorrow at 2 o'clock on the Berkeley Relief Fund website, there'll be a special performance by the Berkeley Symphony. So you can go, you can shelter in place, open maybe a bottle of wine and listen to some great music from our Berkeley Symphony, and also support the work of the Berkeley Relief Fund. We have actually raised over $1 million, and we have set a goal of raising $1.5 million, hopefully by this weekend. So thank you to the thousands of Berkeley residents that have contributed to the Berkeley Relief Fund, including our largest donor, Bayer Pharmaceuticals. The money that you've donated will go to support our small businesses, to keep them in operation, and to help residential tenants that are really struggling to pay their rent, who may have lost their jobs, so that they can stay housed and we don't see an increase in homelessness in our community. Thank you for doing what you can to support our community during this time. Many of us got a $1,200 stimulus check from the federal government. If you can give a portion of that to the Berkeley Relief Fund or to the Berkeley Food Network or the Alameda County Food Bank, it makes a big difference to help some of our most vulnerable during this time, including our small locally owned businesses. I want to give the city manager and the public health officer the opportunity to say some final words before we close.
Thank you, Mr. Mayor. And again, just want to say thank you for allowing us to be on this town hall with you and to talk with our Berkeley community. It's always a pleasure to provide information to our community. And I just can't say enough about the great work that we're doing as a community. and also the great work that our staff here in Berkeley are doing. They are working hard. They've been working in our EOC, doing frontline services, waste management, police, fire, health, our public health and mental health staff, and my leadership team. I can't say enough about the work that they're doing, especially our human resources department, which is one of those departments that you don't hear a lot about, but they're the folks that are behind the scenes making sure that people can continue to work and can also continue to get services and make sure our city is getting the services that they need. So I just want to thank our team and thank you, Mayor, and your office for making sure that we can connect to Berkeley. Thank you.
Thank you. Dr. Hernandez, anything you want to say in closing?
Just also share the thanks that the city manager has also mentioned in terms of the work that our staff has done, the support from city leadership. I feel that the city leadership has supported myself and my staff in terms of the work that we're doing. This is an unusual time for all of us, and I really want to appreciate the community for supporting our efforts in terms of protecting each other in terms of this pandemic. And I just want to wish everyone a happy weekend. As you mentioned, it's a beautiful day outside, so please go outside with your home, with your household, and please wear your face coverings. That's definitely something that's going to be critical as we move forward through this shelter-in-place relaxation. So please enjoy and take care of each other.
Thank you so much. So thank you, Berkeley, for joining us. Please stay safe, and we'll see you next week. Thank you.